In the second layer, we have two long flexor tendons. One is flexor hallucis longus tendon, flexor digitorum longus tendon, and the muscle is flexor digitorum accessoris, and we have the lumbrical muscles. Now, the second layer muscles, it consists of two extrinsic tendons. One is flexor hallucis longus, and the other one is flexor digitorum longus, and we have two intrinsic muscles. One is flexor digitorum accessoris and the four lumbrical muscles. To see all these muscles, now I am removing the plantar aponeurosis. Once the plantar aponeurosis is removed, you see the first layer muscles. So once this flexor digitorum brevis is removed, I have cut this muscle to see the deeper muscles, the second layer. Now here you can see these are the medial plantar nerves, and this is the lateral plantar nerve. I told you before, the neurovascular bundle will be seen between the second and first layers. So once the first layer muscle is removed, you can see this nerve. This is lateral plantar nerve, and this is the medial plantar nerves. And the muscles are like, the tendon, if you see, this tendon is flexor hallucis longus. This flexor hallucis longus tendon, uh, it reaches the sole beneath the flexor retinaculum and abducted hallucis. This is abducted hallucis. So it reaches the sole beneath the flexor retinaculum and abducted hallucis and runs forward, and finally it gets inserted onto the plantar surface of the base of the distal phalanx of great toe. Next, we have this tendon. This is the flexor digitorum longus. This tendon appears in the sole beneath the flexor retinaculum and abducted hallucis. It passes forwards and laterally, and hereafter the tendon separates into four digital tendons for the insertion into bases of the terminal phalanx of lateral foretoes. This is 1, this is 2, this is 3, this is 4. So this flexor digitorum longus is divided into 4 tendons. Next we have one muscle which is this one. So this muscle, this is the flexor digitorum accessoris, or which is also called as quadratus plantae. It arises by two heads, medial and the lateral. It arises from the medial head and the lateral head. Medial head is fleshy and takes origin from the medial surface of the calcaneum bone, and the lateral head will be tendinous and arises from the lateral tubercle of the calcaneum. And when you see the insertion, this conjoint muscle belly is inserted into the lateral side of this tendon, lateral side of this common tendons of the flexor digitorum longus. So the muscle takes origin from the calcaneum and get inserted onto this tendon, which is flexor digitorum longus. And the nerve supply of this muscle, it is supplied by the trunk of the lateral plantar nerve, and action of this muscle is it corrects the diagonal pull of the flexor digitorum longus into a direct plantar flexion of the lateral foretoes. And not only that, it permits the plantar flexion of lateral foretoes in any position of the ankle joint. This is the flexor digitorum accessoris. Next we have the lumbrical muscles. Now if you see here, these muscles, from these 4 tendons of the flexor digitorum longus, you see this muscle. Okay? Yeah. These muscles, if you see. So this is first lumbrical, this is second lumbrical, this is third lumbrical, this is fourth lumbrical. So from the 4 tendons of flexor digitorum longus, we see these muscles which are lumbricals. So lumbrical muscles are 4 in number, and these are very small muscles, and these arise from the adjacent sides of the tendon of flexor digitorum longus, except the first lumbrical muscle, which arises from the medial aspect of this tendon. And the first lumbrical muscle is unipinnate, whereas the other lumbrical muscles are bipinnate in origin, because they take origin from the either sides of the tendon. And when you see the insertion of this, each lumbrical muscle passes forwards as a narrow tendon, and on the medial side of the base of the proximal phalanx, uh, you know, it joins with the dorsal digital expansions through which it is inserted into dorsal surface of the base of the middle and terminal phalanx of lateral foretoes. And the nerve supply of this is the first lumbrical muscle, it is supplied by the medial plantar nerve, and the rest of the three lumbrical muscles are supplied by the branches of the lateral plantar nerves. And action of lumbricals, they produce the plantar flexion at the metatarsophalangeal joints, the dorsiflexion at the interphalangeal joints of the lateral foretoes. So these are all about, this is all about the lumbrical muscles. So these are the muscles which you see in the second layer of the sole of the foot.